Very good morning to everyone. Today's session will be in English. And very good morning to our founder, Dr. Liam Xiaojin, that giving us the opportunity. And also all the CAs, how are you all? Hope everyone fine. So today I'm going to share on the Strengthen Your Immune System Volume 2. Some of the slides same, some updating, some updates and from the research papers I update, so at least you know a lot of evidence-based things in this time we can see. And so without further delay, I will start my first slide. Okay, so now we are very worried about virus. Okay, we are very worried about virus. Everybody stay in house. We look at it about this virus just for 5 minutes, just look at it. Then we see how we can tackle it. And I've done some real case studies. Later I will share with yours, with all the members, what happened to the reality, in reality life, what happened. Okay, you see things that can infect us. Okay, we can see parasites, worms, protists, bacteria, viruses, virusoids. These are the things that can infect us. Okay, and we are talking about viruses. Okay, we are talking about the viruses. So far, millions of viruses out there. I think billions lah. So, but not all been found out and identified. Okay, and you can see some of the type of the viruses: hepatitis, corona, human deficiency HIV, a dengue virus, herpes simplex virus, SARS-CoV. These are the type of viruses we easily always listen, always comes to our ear. So very frequently these are the standard virus that people are known viruses. And the latest known virus is the coronavirus. Is actually coming from some of the SARS-CoV viruses, is mutated and now become more stronger. So we will see on the mutation and lot more actually. Okay, so in this moment we see there's no cure, but only immune system can fight. Okay, we must understand only immune system can fight. So strengthen the immune system and let the body to fight. How we do that? This is the topic that we're going to talk today. How we do that? How are we going to make sure our immune system is 10 times faster or 100 times faster than this coronavirus or any other viruses or bacteria? Okay, you see this is the virus gene. You see from the first level, you can see when come to the second level, there's some changing happening. Okay, you can see from the bottom and come to the second people. When the first person have this virus, when this has been transferred to the another person, the mutation has been changed. That means it's already keep on changing and changing and changing. So when it keep on changing, did you think I can prescribe the vaccine for the A and can it be used in a B? So this is the question mark that been struggling by the expert nowadays. You see, from the first level of animal population, virus reservoir independent spillover event, you can see human population. It start to, from the animals, it start to move towards the human. Some virus after the third generation die, some virus after the first generation die, some virus is keep on going in. But when it highly mutated, the yellow color is highly mutated, it become outbreak. So currently we are talking about COVID-19 is that case. It's already long since 2008, 2009, 2002. Since 2002 SARS, then MERS, then it keep on coming in. And it keep on mutated from 1% to 1% to 1%. And until certain time, the virus becomes stronger than the human population, from the human population. Because why? We are moving towards a wrong direction. Okay, in terms of our food, in terms of our activity, in terms of our daily activity, we are weakening our system. not moving towards the better system. In the longer and in the old age, in 1900, in 1800, people are more stronger. Why? Because they eat a lot of good food, lot of exercise, lot of good sleep. But nowadays we are moving towards the heavy lifestyle. They mean called moving towards money lifestyle. No sleep also never mind, but earn to money. End of the day we spend in the hospital. Nobody taking care their own system, and nobody think about how to balance the immune system, how to strengthen the immune system. And nowadays documentation, nowadays what you call the whole medication system, nobody talking about immunization and strengthening the immune system. Nobody talking on that. Everything got drugs, put in. You are breaking the immune system. Okay. So you see, recent research papers I got recently, I go through, expert on COVID-19 genomes as mutated. Phylogenetic network analysis SARS-CoV genomes. This is a paper I taken from it. Very recent paper. It's already published. We already, the expert already find out there's now what 3 type of mutated: A, B, and Z. A is China, East Asia, US, Europe, and Australia. Now it's mutated to B and also impacted some of the China, East Asia, US, Canada, and Europe, and Mexico. They have a B type of thing. That means AB. Okay. Then now it's already mutated into C type. When you read this paper, they already find out 3 type of coronavirus. That's why they type it A, B, and C. The C one attacked the Brazil, Europe, Australia, US. Okay, so the B type is changing in leucine and ricin, and the C type, they see there's a changes in glycine to valine. So these are the changes they can identify from this virus. That means that the viral journey from Wuhan to Mexico lasting a month, it documented by 10 mutation in phylogenetic network. So they see from Wuhan to Mexico already 10. So the virus genome that was sampled 24 November already is distant from the root type according to the bad coronavirus outgroup routing. This is the finding by the expert with the research paper. So means that when they create one vaccine on December, cannot be used in January, cannot be used in February. The one they keep on updating their vaccine. I don't think this will help the whole nation to survive. So where we are leading, I also don't know where we are leading. Okay, so we must make sure something to be done in a longer run. Okay, so genetic changes in virus, so it's kept on continually changing. So result of genetic selection, so they undergo subtle changes to mutation and major genetic changes to recombination. Okay, so we must make sure we need to strengthen our system. Okay, we have to make sure this is the most of the medical association need to understand this thing and try to find something to strengthen the immune, not to find the cure. Okay, so you see how the virus is coming in. When it touches the NGS converted to enzyme 2 receptors, it attached to that. The first, when it enters the body, it will find the enzyme receptors. Once it's attached to the enzyme receptors, the virus will entering the cell. This is the cell actually. Yeah? Okay, the enzyme receptors is a cell. So inside this, when it enters the cell, it will inside the cell. You can see mitochondria. This is some terminologies. Okay, you need to understand all these terminologies. Just understand inside the cell. When it inside the cell, the virus will override the cell based on the needs of the virus. RNA changes, DNA changes, everything will write down. Why he write the cell? Because normal cell mutate by normal cell, you keep on growing with the normal cells. But when this virus enter into the cell, it start to convert the programming in the cell. When it start to change the programming in the cell, instead of creating a good cell, the mitochondria, the nucleus cells inside the cell, this is the inside the cell, so it start to create the virus back. So it's been reprogrammed to become a bad, like you see the Terminator movie. Last Terminator is sent to the metal Terminator have been sent to the world to help. By end of the day, the bad one will reprogram to become bad. So it's same thing like that. Okay, once the cell has been changed, okay, this cell start to break and it has releases, it start to create more viruses, and this is how it goes and goes and goes. Okay, so a lot of viruses will attack certain portions, but when you see corona, it attacks most of the lungs portions. Okay, so that's why we need to find the immunity to fight it. Okay, how we can change these things. Okay, now we will talk about how to strengthen the immune system. Okay, immune strengthening using the holistic medication for mankind. What we can do? Okay, the first is the GANODERMA. Why GANODERMA? Okay, GANODERMA is the only species that has DNA has been fully sequenced. Okay, so its genome is rich diversity with coding. They call it cytochrome P450 enzymes. Okay, this is actually very good in aiding and riding itself. So it will strengthen the system, and it has the ability to remove the toxin efficiently, countering free radical and increasing the liver metabolic efficiency. So when our immune system getting stronger, we need to find the whole system to be strong, not only lungs. We need to strengthen the heart, we need to strengthen the blood secretion, we have to strengthen the immunity system, we have to strengthen the when you strengthen the immune, automatically everything will be strengthened. It so the main core is the program, the immunity system. The others are the organs. So like computer, even though you have a computer, you have a chip, you have a hard disk, you have a panel, you have a thing, but you need a software to run it. So the software who run it is the immune system. The immune system know how to run it. So what happened? GANODERMA has the ability to rewrite this program to become better programmed system. Okay, and you can see it's supporting the immune response in number of ways. Okay, what are the response? Like GANODERMA supporting GANODERMA polysaccharides, supporting and activate natural killer cells, macrophage T lymphocyte, that has natural bioactive compound known as cytokine production. Okay, in 2000 study, treatment for 12 weeks with the polysaccharide fraction extracted from GANODERMA was seen support immune function in patients. We can see these patients are improved. Okay, so this is the case study supports, and you can see it also have a pro-immune properties. GANODERMA also can help counter some of the symptoms of aging, fight free radical cells, reduce cellular damage, and that association with oxidative stress. So it has all the ability to balance and strengthen the immune. Okay, the research paper has been fully supported and is evidence based that it increases the immune system, immune function, and it able to activate the natural killer cell macrophage. So once these killer cells are very strong, any viruses, unknown object enter the body, the immune system know how to take it out from the body by itself. Okay, this is some of the samples how GL can work into the cellular level. Just now you see virus enter the cell, but when people who taking GANODERMA long term, all the cell is equipped with the weapon. So when the virus want to attack the cell, the what we call the enzyme receptors, if the enzyme receptors know, the signaling can be sent to the enzyme receptor cell. Don't let this virus in. It's like when you know somebody, unknown people come to your house, you go and lock the door. So this is the reprogramming happen while GANODERMA enter the system. Okay, so it will strengthen the system. You're giving the weapon to the system ready. So the cells are strengthened. When the cells are strengthened, nothing can enter into the cell. If you let it go, then it will be a problem. If terrorists enter the country, bigger problem. If terrorists not enter the country, our what we call defense system is strong. Nobody can enter easily. If our defense system are weak, anybody, the terrorists can enter easily. So the border, who control the border? So we need to make sure the border is been controlled. Otherwise, everything will coming in. If the cell, if that what we call, if the virus never enter the cell, it will die by itself because it get the food from the cell itself. So all the cell contains what we call nutrition, protein, vitamins, minerals. So why this virus one? What this virus want? It wants some food from the cell. Okay, it needs some fruit from the cell. So when it needs some fruit from the cell, it needs the cell. It needs to go into the cell. So if you not go into the cell, the virus automatically will die. So this is a process actually. So this is about immunity. So what we do, automatically we can see GANODERMA improve and work until the cellular level. This is called, there's a lot of research paper, GANODERMA work with cellular level has been published and it's been endorsed. It's an evidence-based paper. Okay. So action of GANODERMA lucidum active constituent on different cells. So same thing. So when we keep on taking GANODERMA, our macrophage cell becomes strong, our NK cell becomes strong, our lymphocyte cells become strong, our mast cell becomes strong, our B cells become strong, and some other cells. Every cells become strong. When all the cell combine, because you must see, we are created from a single cell. Multiple become a cell, become what we call tissue become an organ become a system become a human. Okay, so when you combine, when you protect the cell into the cellular level, nothing can enter into your system. This is how it works. That's why GANODERMA is they call it king of herbs. Why king of herbs? Is being recognized in TCM practitioners, the highest nutrition combinations and highest oxygen provider into the human body, and it always in the top range, in the first range under TCM documentations. Okay, so we go on. Okay, this is a research paper about how our when we give GANODERMA to the dengue patients, how it will recover. You can see the dengue virus has been arrested. Okay, from the way you see GANODERMA lucidum. Okay, so the collection of treponoids. Okay, basal screening, you can see treponoids talking, and a selection of the potential treponoids. What are the components is been break down. These components are the weapon to the immune system to fight the dengue virus. So we give the weapon to the body. Body take the weapon. The immune system take the weapon and fight the virus. So indirectly, GANODERMA helping to supply the weapon system to the body to make sure body has all the ability to fight the virus. It doesn't matter virus, it doesn't matter parasites, it doesn't matter bacteria, it doesn't matter. Okay, so the important is actually how we want to provide the weapon into the system. Okay, you must, let's say we have a terrorist enter one country and we said, oh, all the army go and attack them, but you don't supply any of the armies with any weapon. You know what happened to them? Everybody die in the field, because army, every time when they come, they will see what is your strength. So when they know that you don't have any gun also, a basic gun also, they can bring a basic gun and shoot you. But when you bring a gun, they will bring a sophisticated gun. The next time when you bring a sophisticated, so the enemy always fine-tuned to attack the system, the country. So how? So we need to balance and prepare the latest technology into the system. You see, in 27 years ago, Dr. Lim already prepared something powerful for the immune system of the world. Not a single country, it's the world country. We have 180 countries has been used this GANODERMA. He has been futuristic guy. He has been created something that been balanced the immune system. that nobody talk about this nowadays. Lot of companies, lot of medical side, we are talking about vaccine, treat the sickness, to find the cure. But the actual cure is your immune system. The actual immune system need to supply with the nutrition and the natural nutrition and essential vitamins and minerals to make sure it has been weaponized when it goes out in the field. Okay, so this is how we have arrested the dengue virus. This is a paper. You can research the research paper volume already created here. You can get that. You can find and read on the research papers. It's been proved. It's been published papers. Okay, means that until now, you see, for the simple basic virus, dengue virus, until now, the system, the whole medication system is finding a solution. No solution at all. When anybody attacked with dengue, they have they cannot live if the immune is not strength, or the immune never maintain the virus and fight the virus. The person will die like that. But I've treated personally thousands of dengue patients with 8,000 platelet, 5,000 platelet, and I also have one cases 0 platelets. It goes to 0, and the doctor said this case cannot help. But last minute, when I enter to the this hospital, this patient's almost going to coma already. But what I did, we give them a GANODERMA, mix with the water. With the spoon, I just feeding to the tongue. So one day, the first day, every 20 minutes, 30 minutes, I just give a little bit. First day, the same. Second day, the almost 6 to 8 hours to 10 hours, the patient a bit energy. Then I tell them, keep on giving a spoon by spoon. The GL water, we mix with the water. Okay, the GL powder, we mix with the water, we keep on giving. End of the day, he's wake up. And until now, she's living. The hospital, the whole specialist hospital, they said this case cannot be helped. But we make them live until now. So that is the best of the GANODERMA. Okay, we go on. Okay, this is another research paper. It's a very recent research paper. Okay, this research paper, it's actually in 2011. Literature related discovery, potential treatment, or preventing of SARS. Okay, severe acute respiratory system. Okay, so this paper, why I put this paper? This paper already talking about all the epidemic, the pandemic that going to happen in 21st century. Okay, so SARS coronavirus, SARS-CoV. Okay, where it comes from zoonotic origin, horseshoe, all Chirothra, wild reservoir, transmission to immediate host. Okay, human contact with its immediate host, South China, Guangdong province. Okay, South cross species transmission coronavirus, transmission to the virus to both hospital personnel, contact hospital staff. Okay, then you can see the global transmission via the travelers. It's been talked. Okay, it's been written and published in 2011, but we don't take it seriously. So this is the consequences. Now we have to lock up in the house. We lock a lot of animals in the zoo. Now we become zoo ready. Animals are free outside. And end of this discussion, the author has been talk about, okay, additional potential rediscoveries. He's been written about GANODERMA is one of the potential treatment, can be a treatment, can be a immunization for the system to make sure we don't get attacked. So GANODERMA can protect the immune system, they protect the human by immunizing and strengthening the immune system. So chances to get attacked is very, very mild and very, very low. Okay, this is the research paper on that. 2011 has been written already. Okay, so we go on. This is some of the discoveries has been go through. You see how GANODERMA, this is all taken from the research paper. I do in a summary. If you take hepatitis B, GANODERMA already tackled this hepatitis B, significantly protect liver injury, support evidence on immunity effect. This is the reference, the papers, research papers. And we also have HIV, inhibitory against human influenza virus, HIV, H1 protease activity, reduction of the viral load to undetectable level. Okay, so the component herb use is GANODERMA and black cumin. Nigella sativa is the black cumin. Herpes simplex virus, type 1, type 2. GANODERMA shown a remarkable result. Viral replication by interfering the early events of viral absorption entry into the target. Inhibition of viral binding, inhibition of viral entry. Enterovirus, hand and foot disease. I've treated a lot of hand and foot mouth disease in children. Okay, so I've treated a lot. We can see the GANODERMA really help on that. Vesicular stomatitis virus, GANODERMA have a significantly inhibitory effect on this. Okay, and gram positive bacteria, and we have gram negative bacteria. Okay, it's been tackled. And we have hepatitis C. Okay, and we have SARS-CoV, SARS, avian influenza, H1N1 virus. We have androgy also getting a very good effect, and also GANODERMA lucidum, SARS-CoV RDP in dose dependent. So it's been effect. So you see, a GANODERMA, okay, actually is not a medicine. Okay, black cumin is not a medicine. Androgy is not a medicine. Everything comes under herb, and it comes under supplement. Okay, so by taking this, why I can protect my body? Because I immune the strengthen the body. When I immune and strengthen the body, none of the bacteria can enter my house, my body. When these things inside us, when we keep on taking this in a long run, it's become adapted to other body. It become adaptogen. All these things are called adaptogen. You can adapt in every kind of scenarios. Yeah, for the first time, when you start to adapt, you will have some reactions, but that is only a reaction, not a side effect. Only drugs have side effect, but natural, in a holistic medication, we don't have side effect. We only have some reactions, but it's for shorter term only. Okay, so if we can work out with so many kind of viruses by immune system, by strengthening the immune, okay, we can whack all these viruses. It's the same thing, same concept for the corona. Okay, it's the same concept. Immune the system, don't worry about the virus. Okay, we go on. This is all the research papers, contamination, as I explained up just now, the sequence. So you can go and get this paper and go and read that. Okay, so we go on. Okay, GANODERMA is not the form of treatment or medication for curing the COVID-19 virus. So you must know, we don't treat, we don't medicate every people, and we don't say, okay, I cure you with this. No, wrong. You must tell GANODERMA help to strengthen the body immune system to perform nutrition balancing with more than 400 bioactive elements, and these will help the body to fight against the virus. This is the way to fight inwards, that instead of finding cure or diseases, okay, let the body and immune system to be strengthened so it has all the ability to fight and knock down the virus. This is the very powerful wording. Okay, you must clearly tell everyone that this is very, very important. We need to balance the system with natural components, that GANODERMA and some other components, some other ingredients like black cumin, what we call androgy, vitamin C. These are the things we'll talk about later on that. Okay, so these are the things to support the body, to support the immune system. Okay, like you send the army to the war, you support them with all the weapon. You can give them any standard technological weapon so they can go and win. But if you supply nothing, they sure loss. Okay, we go. Okay, now we talk about a little bit on the black cumin. Okay, effect of Nigella sativa. Okay, so it has a highest bronchodilatatory effect. Okay, the studies is been sufficiently studies. Lot of clinical trials about the Nigella sativa have been published and developed. Okay, so black cumin will clear flame blockages, anti-inflammation into lung area, and make sure airflow to the lung is free. So you keep on, I clear all these flames, then your lungs can, you can breathe. The lungs is free. The air can flow free. When the lungs can flow air free, means you have a good lungs. Okay. When you have a breathing difficulty, the lungs has been blocked. The lungs has been inflamed. The lungs has been infected. So you can use black cumin together with GANODERMA. See, GANODERMA is the key. Okay. And this is the supporting GANODERMA, additional supporting. Okay. Flaxseed is used to treating digestive congestion, including gas, colic, diarrhea, cell constipation, and it also has other effect. Okay, and it also used for respiratory condition. Okay, including asthma, allergies, cough, bronchitis, emphysema, flu, swine flu, congestion. Okay, here I have to touch one case. I got one case, children, a baby, 3 years, I think 2.5 years. Every week enter hospital because she will have a single cough. Early morning have a single cough, single cough, single cough, single cough. Went to the hospital, they said pneumonia. Then they give a stay, put the girl in stay in the hospital for third, I think around 3 bottles of antibiotics. They have to wait for 5 days, if I'm not mistaken. This has been continuous for several months. So when I meet the member, I ask them, hey, what happened? Every time you go hospital, what happened? Then they explain to me. Then I say, okay, you give GL and black cumin. Mix in the milk or mix in the honey, because children very hard to take. When you mix in the honey, they like the taste. So when you start to give that, touch wood, until now, they completely solved, clear. Okay. So this is very powerful effect. Okay. And we talk about androgy, Nilavembu in Tamil, Empudubumi in Malay. Okay. Androcafé is most widely used to treat common flu and symptoms. It's also as a actual natural immune booster. Okay. And you see there's a paper, research papers. It also used for upper respiratory tract infections. So any infection in the lung area, androgy playing a big role to clear the infections, to help the body, okay, to help the body to fight. Because see, whenever anything happen to the body will start to find where is my medicine. So to create the medicine, liver will try to find A, B, C, D, E, F. Let's say you only have A and B. He don't have ingredient B, C, D. Then the medicine cannot be created, because liver is actually a chemical factory that created liver and spleen. These both work together to create a medication, natural medicine inside our body to fight the diseases. Okay, so it's all immune system. So when this thing happen, when we give all this androgy, GANODERMA, everything, the body have all the ingredients to find the medicine, to create the medicine by itself. Let it create it. That is immune system job. Our job just eat. Okay, we don't care what you want to do. We don't care what liver do. We don't care what lung do. We don't care what spleen do. We don't need to talk about that. We only care, I take this to immune my system. Finish. Others let the body do. Okay. So we go on. Androgy also found in shortened the duration of cough, sore throat, and sick days compared to the standard care. Okay, I've given to a lot of cough patients. They're coughing for few months. They're taking so much of drugs, cannot recover. When and end up with come and see me. After I give them few days, the androgy is okay, together with the RGGL, everything. Okay, so it also help in the duration of cough, sore throat, all these things. Okay, next, the androgy also has been associated with any no side effect in human study. Okay, in one study, participant monitor for changes in liver function, blood count, kidney function, and laboratory measurement toxicity. Nothing has been found after they giving highest androgy up to 18 up to 6 gram. That means if our capsules is 18 capsules per day, per day, nothing wrong, but the immunization is improved. Okay, we go on. Is preventing inflammatory cascade, cytokine storm. Okay, the cytokine storm, when the immune cells and they are activating compound, okay, cytokines will overproduced. Okay, so during influenza, this surge of activated immune cell into the lung lead to high mortality rates. Why? Because when the cytokine storm started, it will start to produce lot of mucus in the lung, so very hard for the lungs breathing. So this will lead to mortality rates high. Okay, like what happened nowadays, lot of people in the attack of virus, they are pass away, they die. Why? Because they cannot breathe. The ventilators also help them, but not much. Maybe 5% is helping 100 people, maybe 5 to 10% people are saved, but most of them cannot be saved, even though the use of the what do you call ventilator. But so because why? They don't have enough strengthened immune system. They are weak in a system. And we have read about a lot of articles about a lot of people die because they have other issues like diabetes, pressure medicine, heart problem, liver problem, kidney problem, dialysis patient. These are the patients are highly affected. Why these patients are highly affected? They are in drugs in long term. When they when one patient in drugs in long term and taking a medication, not to say bad, but they have that choice to balance, but indirectly they forgot the immune system are very, very low. Okay, if you compare with the people who don't never take medicine drugs and the people who take drugs for maintaining their diabetes, maintaining their pressure, these people, the patient who take lot of medications patient, the immune are very, very low. Okay, so these are the things. So that's why we need to know what to take and what not to take. I don't say don't take modern medication. No, you need to take medication, but you need to know what is the amount, the actual things you need to take. That is very, very important. Not putting everything. Okay. Okay, we go on. What is the scientific evidence for andrography, reducing cold symptom? Okay, this is another study published in 2004. 7 reasonable quality double-blinded controlled trials enrolling 896 patients evaluating the property andrography extract from the treatment of acute respiratory infection. The paper support journal number 11, 12, 13, and 26. The combined result indicate that andrography extract more effective than the placebo for reducing symptoms. Okay, so androgy is very, very powerful. Okay, compared to acetaminophen, Tylenol. Okay, this is the author has been concluded in the end of the studies. Okay, these papers has been published. Okay, so sometimes nature has more powerful than the drugs. Not to say not drug not good, but you can use it together. But when you take together, it's much effective. Okay, because we don't have painkiller, the painkiller given by the nature medication, and we can use the nature together. That's why when you talk about holistic medication, you can take together, no harm at all. Okay, we can take together, or you give half an hour in time frame. Okay, half an hour to 1 hour time frame. You take a modern medication, after 1 hour you take the medicine. Nothing wrong. I've treated so many patients, thousands of patients that they take together. Also, we can see a significant different changes in their body system, immune system, the blood test report, even though they take together. And end of the day, after 6 months, 1 year, the modern medication doctors, they see the system improve. They also shocked the result, and they reduce the drugs amount. Okay, so we go on. Another one, a Russian study questionable quality apparently for an undergraduate phase extract approximately as effective as the drug amanitin or for influenza infancy. See, as the drug amanitin is used for the influenza infection, but androgy, the Russian expert said that androgy has a proportionately effective Okay, if approximately effective like this, like the drug, means why you want to take drug? We can take a nature to balance your body. It means the immunity system. We are immune system. We are immunite and strengthen the system. Okay, this is all the reference on the androgy. And we talk about vitamin C now, Roselle. Okay, current the market, we have ascorbic acid. Okay, Roselle is really natural. The DXN supply Roselle is really natural and essential mineral and vitamins. And it also playing a significant role in human body by reducing inflammatory and preventing common cold. Every day we need certain amount of vitamin C in our body. It's a daily. You take today, tomorrow finish. Tomorrow you must take again. So vitamin C daily you need to top up. Okay, so what are the contents? You can see the vitamin C in Roselle contains is very high in iron, calcium, energy, okay, niacin, ascorbic acid. So it's compact. When we go normal ascorbic vitamin C tablets we buy from the pharmacy, it's only ascorbic acid. We don't have iron inside, we don't have calcium inside. But when you take Roselle, the nature one, you got all the essential nutrition that you needed. Okay, when you have all the essential nutrition you did, you also take care the blood hemoglobin, because you need iron for hemoglobin. Okay, so when you give Roselle, it automatically help the system to increase the hemoglobin also. Okay, and you see one of the uh, what do you call a paper that getting from the net, critical COVID-19 patients successfully treated with high dose of vitamin C. Okay, you can see Dr. Inkin Mao, okay, in Ruijin Hospital, Shanghai treated 359 COVID patients. Okay, 19 patients in critical care unit with high dose of vitamin C ranging 10,000 to 20,000 milligram a day for 7 to 10 days. None of the patient died. Okay, so more use more, vitamin C more than 10 years. So vitamin C is very, very important to strengthen your immune, especially more to your lung area, and in also naturally it become a antihistamine. Okay, okay, now we already talk about the product itself. Now we talk about 6 tips to ease infection symptom using the DXN and alternate remedies. Okay, what we can do, what are the 6 tips that very, very important for us? Okay, first, you must stay home, must follow the government rules. Okay, mind your flu manners, get yourself isolated. Let's say you get something out. Nowadays we don't know, we don't have enough test kits in the house to check. Okay, so if everybody have the kits, we can got flu, we can check whether it's the COVID or not, but we don't have. So whenever you have any flu, first you get isolated. So on the first day you have symptom, tell the office or whatever, you don't go, you make sure you stay in the house and try to do a lot of readings, all these kind of things. Okay, and the second one, drink plenty of fluids. Okay, make sure you get more warm liquids, don't take all the cold drinks, stop all the cold drinks, stop all your carbonated drink, don't take. Okay, it doesn't it doesn't matter it to be water, you can go for fruit juices, that vitamin C, hot drinks, broad based soup like chicken noodle soup or whatever. Use black pepper, ginger, onion, black cumin, yellow cumin, turmeric, jujube, goji berries more into the cooking. In your cooking, you also can use lot of vinaigrette. Our vinaigrette is a very good in the use in the cooking. When you cook veggie, you can put little bit. It's actually really helped us our immune system. Okay, so keep your respiratory system hydrated and help to turn that nasty mucus into a thin liquid. You can go cough out and spit it out. Make sure you feel something in the throat, try to cough out and spit it out. Okay, don't keep. And you can use so many things. Okay, if you have a throat itchiness, gargle using, you can take a little bit of Ganozid toothpaste, apply in the water, warm water, and you can gargle. You can add into a Himalaya salt also. Okay, currently we already have our Himalaya salt. Okay, you can take lignosus syrup to clear our chest phlegm and to control your cough. Okay, for vitamin C, we have roselle, lignofine, honey vinaigrette, lemon Z. Okay, this is all high in vitamin C. Okay, to make sure your respiratory and urinary system is strengthened. Okay, so lot of products actually DXN already come out for you. You can use this and take, because whatever you take is naturally created and non-chemicalization. It's a natural. Okay, so it giving you more immune strengthen. It more immune strengthen for your system. So take the best one for yourself. Take more warm water. Okay, don't go for cold. Stop all your cold drinks. Okay, to make sure in this situation, don't touch any cold drinks. Okay, better you go any warm. Okay, the next one, treat H's and fevers. So let's say you got fever, what are you going to do? Okay, you can take Andro-G 2 capsule 3 times daily. You can mix with roselle juice 10 ml, GL half scoop, lignopine 5 ml, lignopine to strengthen your lung, half scoop of pearl powder mixed with 50 ml warm water, repeat every 3 hours. This will reduce your fever. Okay, at the same time, you can add in RG, black cumin, spirulina. You can take standard dosage 2 AM, 2 PM. Okay, you can take 2. Okay, or you want to take more, is your wish. Or you want to take mycovita half dosage per day, it's your wish. Okay, but people who really got attacked by the virus, they can go mega dosage. Okay, they can go mega dosage. Okay, if you don't have enough cash to buy a mega dosage, you can go to the solutions and repeat the solution every 3 hours. That's another way to balance. Once your system already balanced and become normal, okay, try to maintain the normal maintenance mode. You can maintain the normal maintenance mode. That means Andro-G you can take 3 times daily, black cumin 3 times daily, GL 3 times daily, RG 3 times daily, roselle 5 tablets 2 times daily. This is the basic dosage I'm giving to people that who has that ability to buy this level. If you have ability to buy more, you want to eat more, no problem. What I give you is a minimum dosage that the person, the low level layman can buy and eat. This is very, very important. Okay, at least you got something inside your body to protect you from the disaster. Okay, the top number 4, take care of your cough. Cough is very, very important, because the more you cough, the more tired you will be. Okay, so when you have a heavy cough, what are the concoction you can do? 10 ml Dignasis syrup mixed with half scoop of GL powder. Okay, if you have capsule, you can use 3 capsule of GL powder, a GL capsule. You open the capsule and put into the thing. Mix with 20 ml warm hot water. Shake it, give every 1 hour. Okay, you must giving every 1 hour. Then you can see the cough will reduce. Once the cough getting reduced, you increase the time frame to 2 hours, then 3 hours, then 4 hours, then slowly you can maintain it. Then go back to your normal dosage, RGGL, spirulina, and Andro-G, all these things. Okay, then mild cough, same concoction, you can give 3 hours once. You can apply this to any children. Okay, children that can eat after 6 months, you can give. The GL powder you can give to the baby, no problem. Lignosus syrup also I already given to the baby, and she's okay. It really works to the baby. 1 month baby, we give a 5 ml of lignosus syrup. Then when they cough all these things, then they ask me, I said lignosus syrup, the same concoction I give. GL, I ask them to additional add into their milk also for the babies. Okay, if the throat pain, itchiness, inflamed throat, very bad, you got very high itchiness, okay, you can do this. You can suck the Andro-G or RG capsule every 3 hours. Automatically your tonsil, your itchiness, anything will be stopped. Okay, this is a really tested. All these things, the concoction that I give is already tested with the patient, live tested cases. Okay, so no worries, nothing to be no need to worry at all. You can freely give this dosage. Okay, number 3, you can use if you feel your body is very tired, all this thing, you can take some steam therapy also. Okay, so you can go to the bathroom, you can open the hot water and let it be moist, so you can become a called like spa. Currently you cannot go spa now, all the stuff close one. Okay, so you can mix up turmeric, Himalayan salt in a pail of in a small bowl. Okay, then you can inhale it. Okay, like the photo I given here, you can inhale it, and you can do steam inhaling. You can add in a little bit of black cumin, zimiko, turmeric, ginger, lemon crush, and boiled. Inhale the steam and steam it. So this also will help you to clear the chest area. Okay, and night before you sleep, apply the chest area and nose area with the zimiko. Zimiko is really good. It will enhance your breathing. It helps your breathing. You can apply for the children. You can apply zimiko in a handkerchief and put in the chest. Okay, don't put their body, don't apply it to their body, but you put in the handkerchief, put near to the chest. Let the smell help them to breathe. Okay, we have treated this lot of cases of babies. They cannot sleep because they have nose block, so they have cough, they have this one, they have some kinds of inflamed, so they cannot sleep well. So when you do that, they can sleep well. Okay, number 6, get salty to release the nose block. Okay, you can get some saline drops, nose drops or sprays. Okay, and also you can prepare some on your own spray. Okay, you can get a small 30 ml to 50 ml spray bottle, mix with a small amount of Ganusi toothpaste, vinaigrette 3 to 5 drops. Okay, this is for the 30 ml dosage calculation. If you increase the dosage, you increase. Okay, shake well and spray to your nose, blocked nose. So daily you need to change it. So this is you do one time only, because you cannot keep long. Maybe you can take 1 or 2 days, put in the fridge, but we don't want cold things to be attended. Okay, we go on. Okay, this is the Licknesses syrup concoction, all the ingredients listed, and you see some of the research papers. When I go through, I found that after the China treated, China is using almost nature TCM treatment together with the modern medicine. They're doing an integrated treatment. Some of the highlighted ingredients is already got in our Licknesses syrup. This is a powerful ingredient to help to clear the chest, and also help to clear the flame and help to stop the cough. So this is the Licknesses syrup, very effective Licknesses syrup. Okay, then you need to clean your house also, need to clean your hand also. DXN already provided a pine clean to clean your house, because pine clean has a property of disinfectant, sanitizer and deodorizer. So you can clean your house, mop your house, you can wipe all your tables, everything using the pine clean. You can clean your car dashboard, everything inside using pine clean. Okay, and you can use the hand sanitizer to clean your hand. Our hand sanitizer have 75% alcohol mixed with aloe vera. Why aloe vera? To protect the hand skin, because too much of alcohol you put is not good for the skin. But when you have aloe vera, it will help you improve your skin. Okay, and this is the important. Make sure you always clean your hand. Okay, we have a Ganu soap and body foam. Okay, Ganusi body foam. These two things you can use for clean your hand. Okay, you must understand GANODERMA has the effect of remove toxin. So even though our soap, even though our body foam, anything used externally also clean your toxin outside. Okay, and also we clean toxin inside. Okay, this is the both ways. So we actually cover the whole body, internal and external. Okay, so why our product has the best quality? Okay, you must understand. We have a quality, proven quality testing. Okay, our product, we have a 3 ISO 9001, ISO 14001, ISO 17025. Okay, we have a GMP, we have a TGA, we have HACCP, and we have halal certificate. Okay, we are very strict in QC. So the product is amazing and fully certified. So no need to worry about the product. Some people always say, oh, got this one, don't get the. No need to worry. Everything is certified. You see, as Dr. Lee mentioned one of his talk, we are the first TGA endorsed company in Malaysia. Okay, we are the first TGA endorsed company in Malaysia. So we have really proud to say that. Okay, it means we really control our. Then second thing, ISO 14001, good organic for good and organic environment. This is the international standard of organic and farming. Is more powerful than the organic certification. ISO 14001 for good and organic environment is very, very powerful than the normal. We also have the Asian, Malaysian organic endorsement. Okay, so these are the things to sure to. Now I think can hear. Suddenly the mic is muted. Okay, so okay, so these are the quality on our product. Okay, okay, so everybody work together to stop the spray. Okay, this is my last slide. Thank you and pray for the best, save the world. And the important thing, stay home and follow the ministry, the government rules and regulation. That is very important. Okay, Zakri, so you can take over.
All
Zakri, are you in
right.
the line?
Okay, Doctor. Okay, thank you very much to Dr. Siva. So a lot of information, knowledge we can get from this webinar. The most important thing is the step by step. And the guide for us to use and to consume our Exterior DXN product to strengthen our immune. Right now, I open to yes, question Q&A. So you can ask your question in the question area. You can find your phone or your laptop. Please type your question. I will pass to Dr. Siva your question. All right, doctor. We have in the chat area. We have two questions earlier.
Okay.
Number one is asking about one month old baby.
I have newborn baby who is just 1 month old. Please share some tips how I can protect the newborn baby from the virus infection. I think I already talked about it just now. Okay, you can give them give the baby GL every day. Okay, you can currently 1 month baby you cannot give any spirulina cereal. You have to wait until 3 months to 4 months. 4 months above you can start to give spirulina cereal. But the best is you can give GL every day. Okay, there's no amount to amount you can give anytime, any amount, no issue. You can mix in the milk. You can give every day, and you can use the Zimico, as I told. If you have any breathing or any running nose, anything, you can take a Zimico. You can apply to the handkerchief, and you can put under the chest area. Okay, these are the things you can give. You can also most of it for babies very less, but if there's a you can lignacid syrup can give, no issue. Okay, lignacid syrup for 1 month baby can give. GL you can give. This is the most of you can give. After 3 months you can start to give most of the like a spirulina juices. You can buy some powder and give some spirulina water to the baby. Okay, after 3 months. Okay.
All right.
And the next question is, what is the difference between one in all and individual products for all? Like some products claim that with one product they have all essential vitamin and minerals, but whereas we have different products. Okay, you see, the main key is immunity system. Okay, you can put addition. Like what you see, like when you eat rice, you only can eat rice and can survive. Eat rice, put some water, some with water, without salt also you can survive. If you don't have any food, when we have what you call darurat or curfew terms coming in, you only have rice. People can eat rice and live. But when you have put salt, you feel better. This is how it talks. Okay, when you eat rice with curry, with chicken, with fish, more better. That is how it goes. Okay, the important is the GANODERMA. That is the main key product. The importance of GANODERMA is to strengthen the immune system and make sure your body has all the ability to fight the disease. Okay, androgy, black cumin, spirulina, you can put additional together in to make your strengthen your system become more better, to make your system, your taste more better. When I give you fish, you feel better, ma. When you give you chicken, you feel better, ma. This is how it is. Okay, that's all. But everything is very powerful to balance. The important key to remove the toxin, balance your system. That is the main. So the GANODERMA is the main key of all the products. So whatever it is, you must take the GANODERMA first. Then you add in others into the picture. Okay. I think question 2 I already
All right,
answered.
Doctor. Yeah,
Any other
the
question?
next question.
Okay. How to
Uh,
decrease body age
yeah.
related to aging process? I am in 50, particularly when I wake up in the morning. Okay. Body age due to so many reasons. Okay. Body age due to so many reasons. Maybe they don't have enough exercise, so body age. No blood circulation of body age. High uric acid also body age. Okay. So, so you must balance. You must know where is the problem. Increase your exercise. Relax your body. Okay, take hot shower. Okay, can take hot shower every time. Can do some exercise. Can do some tai chi, minimum movement exercises, because physical also make your immune system strengthen. You see, if I ask you to sit down for 10 hours in one chair, can you sit? I tell you, your body will cramp. Okay, but if I ask you 1 hour you sit, 1 hour you walk, 1 hour you stand, 1 hour you can do. So this is the difference between. So body need a movement. So you need a movement. That means when your body always itch, means you not enough movement. That means your water circulation, blood circulation in the body not very good. So you can take GANODERMA, you can take enzymes, you can take spirulina, you can add in all these things to make sure your body system are moving. Okay. So the next one, I think I already answered that. And the next one, my audio got problem enough. I can't do anything. Oh, okay. Okay. So can you share the slide for us, convince people, especially the double-blind papers? Okay. Later I will put. This will be recorded into. Actually, all these papers has been already recorded, and it will put in the Facebook. Okay, Zakri will put in the Facebook. You can get it from there. Okay, you can get all the talk together. You can take some of the important points and you can use it. Okay. Okay. The another question I see here is okay. Another question. Wait, I coming in. Okay. Is there any difference between spirulina capsule or tablet, which is the most suitable for baby children? Okay. Some children, when they have a teeth, when the first teeth come out, you start to give them one tablet. They will try to eat that tablet. When the first teeth come out, like my children, I started with that. When the teeth come out, I start to give spirulina. So when they grow, they start to eat spirulina. Okay. Which age can still start RG and GL? You can give RG, GL from womb to tomb. Means when the baby start one day in the womb, you can start to give the mother RG and GL. The first day it born, on that night you can give, on that 10 minutes you can give. You cannot born terus give lah, you cannot cuci baby dulu lah. You have to wash the children, make sure, then you start to give. You can give the GL immediately. Okay, so no harm. It's really safe. Okay, it's really safe. Okay, so for the baby children, capsule and tablet not different, all same. Okay, no or no different, all same. It depends on the children which one they like. Some children like capsule, some children like tablets. It depends on the children what they like. Okay, good. Any other questions? Oh, I got another question. When mix 3 to 4 supplement in a bottle with warm water, is there any reaction in the bottle so that it may be toxic to the body when it is taken? Actually nothing. It's a food. It's a food. Like you take rice with chicken curry with fish, with this one, with Coca-Cola, all this thing, is it happening something to you or no lah? You can take. Food is no choice, no problem. You can take. Okay, there's nothing to be worried. There's nothing toxic. Natural is always a natural. Okay, for hyperactive children of age 9 years, what is the best to take? Okay, hyperactive children, you need some of the neuro disorder. So they born in that situation. Okay, they born in that situation. The born is from the womb itself. That means the process of the system is not fully completed while the children in a thing. So they become hyperactive. So you can give GL, RGGL, and cordyceps. Cordyceps will play a big role on this thing, but RGGL also you have to give. So you can see a lot of changes on your kids. Will GL and accumulated build up our protection? Meaning as we take it long term, it will create baseline protection of our bodies. No, GL is a food. Like you're taking rice for the whole year generation. Okay, it's like that. Okay, when we talk about holistic, it's actually a food. Supplement is under the food. You see, all the holistic medication is actually comes from the food. Nature is come from the food. Okay, we created it as a food. So when you take it, it will keep on in the body and it keep on protect. Like we eat every day. Why we eat one day and 10 days don't need to eat lah? Why you keep on eating? That means you drink today, you don't need to drink tomorrow lah. So it's not like that. It's like long-term process to build the system. Okay, long-term process to build the protection, to build the system. Because you see, we are going out and we are exposed with a lot of bacteria, viruses, everything. Our body is under attack every day. So every day you need to protect your system in daily basis. This is for the long-term maintenance. You need to take for long-term, keep on taking. Like how we eat. One day we eat, 10 days we don't eat. We don't do that. What every day we are eating. Why? We need to survive. So this survival needs a lot of nutrition to be built in our body every day, daily basis. It's a very, very important to continue every day to make sure the protection has been taken in charge. Okay, so that is the important on the protection build up. It's acclimated. It's a maintenance. You need to balance the body in a long term. Okay, Zachary, I think
All
this
right.
one they put last question.
I think got one or two very interesting question. Can I?
Okay, we open for the last two, then we can close lah.
Right. I think because this one is for autism. Any
I
suggestion
think
product for autism?
autism, I just now autism. Okay, autism, hyperactive, dysphasia, almost in a same category. Okay, you can give cordyceps, RGGL, and additional you can give a spirulina for the nutrition for the kids, because these autism kids they don't have enough nutrition. Okay, so you can for the nutrition base you can give spirulina additional part from RGGL and cordyceps. Okay.
All right. For the last question is for old people with heart failure, with a lung problem or kidney failure, what can be recommended for immune support?
Okay, basic GANODERMA, RG&GL. Okay, basic is RGGL is a must. Okay, to balance, detox and balance the system. Maybe you can put RG less, GL more in the first phase. Okay, then you can add in black cumin, codipine, enzymes, all these things depend on the case basis lah. Because we must see how bad is the system. Okay, so based on the case basis, you can add in slowly codipine, morinzyme, morinzi, this black cumin, spirulina, all these things you can add in slowly. So first you start with RGGL, then you start with one by one, slowly you give them. If you feel they feel very weak, so you start with slow and steady, level by level. But RGGL is a must. Okay.
All right. So thank you, Dr. Shiva. So I hope, of course, we kind of finish all the question, but most of the necessary question has been answered by Dr. Shiva. So thank you once again. And any last word from Dr. Shiva before we end this
Okay,
webinar?
thank you everyone joining my session. We will see on the next session coming soon. Later part will be announced accordingly. And thanks for your time, and thank you. Have a good life. Make sure every day you eat RGGL and all the necessary things I already shared to you, and everything is help you. DXN is always there to maintain your system and help your system. Thank you very much.
All right, ladies and gentlemen, once again, thank you very much. Thank you for your time. And we will see you on the next webinar for Malaysia. We have one more on 14 Tuesday night. So please be available and register to this webinar. So thank you once again. I hope we can stick to this webinar and pull all the crowd to this webinar to fulfill our knowledge and also stay at home situation. So once again, please stay at home and let us stop COVID-19. We strengthen our immune, and of course, please stay healthy with DXN. So once again, thank you very much for your attention, and hope to see you again. I'll see you at the top. Bye bye.
Bye. Thank you.